before that as well to get the full.
So here we are, our first Thursday with our new kind of protocol, our new planning of once a month getting online and having a case study or something we can work with. And I'll put these together. They're on our blog pages, and this recording of tonight will go on that for people to sort of follow up and look at later. I got these case studies partly to do with the trail guide in relation to my membership of that. So they're useful, and I think they get us thinking. We're gonna start with Sophie, who's a rower, and let's have a what are people's first impressions of this lady?
I'm not going to lie, I didn't get a chance to read it. So,
good, that's all right then. So you've got absolutely no impression of Sophie whatsoever?
No, not at all. I like her name. But I've literally just walked in from work and just thought I'm going to zoom on and just hope for the best. That's the best.
Well, I'll give you a little bit of an impression with Sophie, and then you can decide where you go from there. She rows, and she considers herself a fairly fit, high-level strength conditioning lady. She's successful in her sport. She's part of a team, and yeah, she's learning how to row and strengthens. I don't know, improving her skills. Is that a good summary, Gambi? Anne,
yeah.
You've read? Yeah.
Yeah.
Doesn't say how long she's been rowing for, but after training for about 2 months. Sorry, go on.
Not long.
Not long, yeah. So it says after training for 2 months,
Yeah.
Sophie began experiencing sharp pain, so 8 out of 10, which is pretty painful, isn't it, on her right side of her rib cage. She tried to push through the pain, but it hurt her when she took a breath, twisted and pulled at the oars. So she's doing that kind of extension move, I guess. When she felt the area that hurt, she noticed a lump that was squishy. Now, I don't quite know what squishy means. I've got some idea what squishy means, and very tender to touch. So, yeah, it gives us a really nice kind of real live kind of, this is the stuff that comes into our clinics. Any initial kind of observations and thoughts about that?
Intercostal muscles?
Got to be, isn't it? Something like that.
Lats?
Or stress fracture?
Yeah, I wondered that. It's an interesting one, isn't it? Just seeing how much, what has she done? Yeah.
I thought intercostal, but it's the squishy, tender to the touch lump. That's the concerning bit, isn't it? Is it something that...
The next paragraph goes through the clinician's work and the kind of observations that he or she made of this lady, taking the history. They learned that Sophie had felt a pop a few days prior with significant pain afterwards in the ribs. So before this actually happened, she felt some kind of discomfort. Is that how you read it? Is that how you sort of read the notes? Her breathing pattern was shallow due to the pain. So it feels like, yes, the rowing aggravated something that popped, that gave us some discomfort earlier. That was my kind of summary of it. What do you think? Showed a positive rib compression. So when you press on the ribs, if the client goes, ow, that's a positive sign. So that draws us to intercostals, absolutely. Mm-hmm. And then the anterior posterior compression. So you press from the side and then you press backwards and front to see if there's, I suppose what you're looking for is, does this person need referring in terms of a cracked rib? Is there been a history here, something? I think that's what you're looking for when you're doing that compression.
So what would a pop be in her ribs then?
Good question.
would it be? Because you can burst blood vessels, can't you, in other parts of your body? But would you be able to do that in your rib?
The rest of the observation is that there was no discolouring, so no bruising to the area. Didn't get a sense of feeling, gosh, that, you know, inflammation here. The only bit, it didn't give me an idea of heat. You know, I didn't have that sense of feeling the rib cage on the good side and then the bad. You know, is there inflammation in the system here?
It does.
It
does
says
say here.
discoloration and edema present.
Oh yeah, forgive me. Yes, it does. Yeah. There was some discoloration, forgive me, yeah, and edema present over the area of complaint. Absolutely, my apologies, sorry. Palpation over the adjoining thoracic vertebra was unremarkable and the trunk normal pain. So, based on this scenario, what different diagnosis would you consider for Sophie?
I suppose it depends on the discoloration, doesn't it? If it's sort of a bruise or a lot of blood there. But I mean, nothing was cracked, was it?
No, I don't. I would think you rule out. I think to damage a rib in that way, you're going to have a history of, you know, we've all broken ribs, have we? You know, where you fall over and hit a wall, or, you know, it's quite an impact where you crack a rib, you fall off your bike and hit the ground.
My mum fractured her rib without realising because of the tablets she was on.
Okay.
So she had, it was a hairline fracture, but it was because of her illness. But then it doesn't say she's got anything underlying, does she?
No, I don't think, no, I think we kind of.
Yeah. Do you think it could be a blood vessel and it's popped, or like a?
Well, I suppose the edema would be some level of protection for the damaged intercostal muscles. What have we got there? We're looking at sort of sixth rib, aren't we? That seems to be the kind of area that's kind of identified as the area, you know, the problem area. So finding the sixth rib area would be, if you stand behind somebody, put your fingers on their inferior angle of their scapula. Yep, pretty well a line between both your thumbs is seventh rib.
Okay.
It depends on how elevated their scapulas are and how built up they are, but generally speaking, inferior angle across the middle is seventh rib. Pretty much, and then you can see, right, you come up a certain rib. So there you're looking, what muscle groups sit through that kind of discipline there? What kind of stuff are we looking at?
Right, like your teres minor and major around the area.
You're say, Debbie?
Serratus anterior.
Serratus, yeah, going to be serratus anterior. I think that's a bit of a, given that is a muscle that, shall I screen share a bit of this? Is this useful for me to just play with? Let me just open up the muscle app here, and I think it's never a bad move to just have a quick play with this kind of stuff and just remind ourselves of the groups of muscles through here. Let me just screen share. So here's our little person, as we know, and if I come into, can you all see that? Okay, is that all? So as I put some connective tissue on, then we can start to see stuff. Drop that off. So that's all our sort of ligaments in place. And then if we start to drop on our muscular themes. So here's, sixth rib, and so you're going to come round and Here's serratus. And if I do some of the movements of that, so here's our sixth rib. Oh, it's not got a highlight for me, sorry, but yeah, that's going to sit bang on that kind of in that rowing position where you're pulling. You're going to use lats and serratus here, aren't they, to stabilize the if I just go back and pop lats on here, just have a little play for a minute around that. Yeah, fade all. You've got rhomboids, you've got serratus, you've got lats, lower trap, and that 12th rib sitting, sorry, 6th rib sitting underneath lats. Around the front, this kind of area. Interesting, isn't it? We haven't got a really clear idea about exactly where the tenderness was. Other than with the compression test, positive sign on 6th rib, tender over the rib, and adjacent ribs. And I guess, you know, these intercostal muscles here, yeah, that's going to be the place to start, I think.
So if she had a lump though, Chris, would you not send her to the GP anyway to get that checked out? Because it could be a tumour, it could be cancerous, could be anything really. But it's a squishy lump that she's not had before.
Interesting that it occurred prior to it. Learned that Sophie had felt a pop and a few days prior to with significant pain towards the ribs. You know, I think you're right to be cautious, Anne. And I think you're probably right. It's not the kind of thing. Lumps don't just, you know, lumps generally appear over a period of time, don't they? We're right to be asking those. You know, is this a red flag? Is this something? Do you know what? This needs just another set of eyes on to be clear that there isn't anything, as you say, potentially more sinister or a concern. Absolutely, to draw those conclusions. I don't know. I'm not sure. I think the story of us being there, touching it, getting an idea, the story of it just popped. Don't know. I mean, in the same way as you have your client earlier on that you were talking about, the hip just went clunk. The concept of that is, does the actual ball and socket pop out? Well, of course it doesn't. But the experience is quite alarming. So you know, how we put thought. Well, the phrase I used to use a lot in my old job was, do we put thought between our impulse and the action? You know, our impulse, gosh, you're going to go and get this clonking hip x-rayed and scanned, where in fact it's just a series of tendons that are popping over each other that give that horrible sensation, and she's just tight and needs our skills. Do you know what I mean? So putting thought between that doesn't mean she doesn't need to get checked out. Please don't think I'm being kind of dismissive. Far from it. I'm just thinking, well, let's just have a think for a minute, gather the data. This lady is walking, she's running, she's doing all the things she does in her life. Her hip, if it was very badly, if there was a joint issue, there will be a whole series of stories about that, which you're not being told, other than when you bring a knee onto her chest, it hurt a lot. So here we got somebody who's got popping noise, movement. What's happened here? She's done this. This is a very demanding sport. She must do rowing on a regular basis. This isn't the first time she's got in a boat. When did she train last? How much rest has she had? How much water does she drink? Does she look after, that whole story of what gets to the point where you learn that Sophie felt a pop a few days prior to, and with significant pain around the ribs. Her breathing patterns were shallow due to the pain, and it hurt when she laughed. Is that just like what I would call a sticky rib, where our intercostals go into spasm and lock up? And I guess we've all had that at times where we can't move our ribs because these intercostals kind of get cramped because of our lack of stretching and our, that's all the program we would want to know a bit more about from this lady, wouldn't it? Mm-hmm. What is she not doing? She's certainly rowing. She certainly wants to do very well, and she's working hard. Is she stretching? Is she looking after herself? Does that make sense? So, what are the different diagnoses would we be thinking at? Have you got any thoughts? You and Gabby, you come across this regularly, haven't you? Your coalface interaction with rowers.
Every day, Chris. Every day.
I thought this was a regular interaction for you. I mean,
Yeah, I'm thinking along the lines of something is going on with the rib.
Yeah, I think that's
and I'm just wondering whether there could be an issue like a stress fracture kind of damage. So maybe the muscle caused the damage on the bone. I don't know.
Yeah. There isn't I don't know enough about stress fracture. I'm kind of guessing that if you have a fracture, then there's a story of some impact. Mm-hmm. Yeah. Would you agree? I mean,
yeah.
Hairline fractures and things like that in ankles and talus bones and shin splintsy type issues are usually driven by an over impact issue. So you're being kind of upping your miles very quickly, or you suddenly come off the road, off the grass and the cross country, and you're on the tarmac. And there's a story that suddenly you think, do you know what? Overnight, you've changed your training program without really thinking through the consequences, and here you are with a hairline fracture. That's usually the story. There isn't here. Maybe we're not getting told enough story, are we? We're just picking out the pieces here and making it up as we go along. But it gets us thinking, doesn't it? It gets us thinking about, it's so important, that kind of subjective part of our assessment. Tell me what's going on for you. I need to understand more about this rowing. How long have you been doing it? Do you come across as somebody who, do you know what, I just don't warm up, I haven't got time, I haven't got any time for warming up, I just get in the water and off I go. If I can do 100 miles an hour really quickly, I feel good about myself. Or are you somebody, before I come to the boat, I stretch out, I look after myself, I carb myself up so I know I've got plenty of fuel in the tank. I always, the night before, I get some fluids on, I do a good stretching program. Before we really push out on the boat, we always go up and warm up and get that whole kind of muscles ready for the kind of, the gun to fire when I need it to. Do you see what I mean? Getting people's stories is so important, isn't it? And we haven't got that. I've got a little bit of a sense of her being, she tends to get stuck in pretty quickly.
Yeah, she seems to be really putting herself seems
Yeah,
like.
maybe. I don't know. That's just my gut feeling about it. It doesn't say that particularly, I think. High level of conditioning and strength training required to be successful. She's been beginning learning interest of this. She, as a team member, spent a lot of time in the boats learning how to be properly in the scull and script. So you get a sense of somebody who's really quite proficient at rowing and is good at what she does. Has she overdone it?
She's been doing this for 2 months.
Yeah.
And I've just Googled this. Is that allowed?
Oh, good. Dan. Rescue me, for God's sake. Rescue me. Go on. What have you got?
It could be slipping rib syndrome.
Slipping ribs, which is, yeah, okay.
It could be slipping rib syndrome because it talks about where you get the pain. It's more common in women than it is in men. It doesn't have to be connected to a trauma. It could just be, or an injury. It can just happen. But there is a slipping, popping, or clicking sensation in the lower ribs.
Nice one.
So difficulty breathing, worsening of symptoms when bending, lifting, coughing, sneezing, deep breathing. And it says here, it's believed to be a result of hypermobility of the rib cage, costochondral, or ligaments, particularly ribs 8, 9, and 10, because they're not connected to the sternum. So if she's just started doing this action quite vigorously over the last 2 months, maybe this is it could be that.
Yeah, I like that, man. That it's a little bit low, isn't it? Because it seems like the trauma is a bit. It's more 6 and 7, yeah. 5, 6, and 7. That's the sense you got of it.
She's got pain 9 and 10 with palpation. So that was the only reason I thought that. She has got pain in 9 and 10. And she's got tenderness.
Yeah. And it's inflammation of the intercostals, basically. Is that what you're saying?
Yeah, so it's cartilage in a person's lower ribs and moves, leading to pain in their chest or upper abdomen. Goes by many names, but it's that popping, clicking noise that drew me to that as a potential for it.
Yeah, and isn't the pain more around the front, in the bottom of the sternum?
No, it says 8, 9, and 10 on this one.
Okay, good. Well, that's it then. Well, it's been very nice spending the evening with you. We can now we know it's a sticky bit.
But it's the lump. It's the lump.
Yeah.
Yeah.
So that's the inflammation of the lining of the rib, I guess, or that intercostal aggravation. Yeah, I get that. I have to say that I don't think I had a I don't think I've had any. I've had an impact on a horse rider who came off and broke some ribs and had a continual kind of ongoing issue, and I had to do lots of work on intercostal ribs and MET and all that sort of stuff that we do. But over, unusual that you get, unless there was an impact, these kinds of issues, which is interesting, isn't it? I guess it'd be interesting to make contact with the rowing community and just see, is this a common? I kind of bet it is. I bet this is not just a sort of a one-off. You're Googling, aren't you? And I can see you're on a roll. I can see that.
That's what you would do.
I'll waffle on for another 5 minutes, and when you're ready, you come and rescue me. All right? So that's fine. I'm quite cool with that. It's really good.
Pain along the rib cage is a common complaint among rowers.
Yeah. See. Yeah. So when in doubt, take up tennis or something like that, or swim or something like that.
Oh dear.
So sadly, she needs to rest because of inflammation. She's going to need to sort of stop her activity, isn't it? Or if you've got that aggravation, then irritation, your rowing is going to just aggravate it, of course.
It talks about a rib stress fracture symptom being a dull ache, a sharp pain, and swelling.
Yeah.
And bruising around the rib cage. Yeah.
Yeah. So in the questions at the bottom of the page, I've just thought-provoking, aren't they? You've got a list of trail guide, picture guides there in terms of pages and what to look for, and what pages tell us what, in terms of muscle groups and synergists and all that kind of stuff, which is always helpful. And then you've got, I don't quite understand this question. What is the mechanism of injury for Sophie? So if we go down your road there, and so this is an overuse injury, I guess?
Yeah.
So this is something where hasn't really listened to her body particularly. Would that be one way of looking at it?
It could be
maybe
indicative.
Does she get soft tissue? Sorry, go on.
It could be indicative of her posture because she's new to the sport, because it says in the case study that she's learning how to do these new techniques. So she might not be, her body might not be in the optimum position for that, which may have then caused this injury.
Yeah. Rowing, that position of sitting and pulling right forward with your knees up and then pulling right through it puts a hell of a strain through the capes, through your whole core stability and lower back. So technique is everything, isn't it? And you're right, maybe she's pretty new to this game, and like all of us, fiddle around and overdone it or overused, or something's happened, isn't it? Yeah. So the mechanism of her injury being technique, early to the a beginner, or early but enthusiastic, wants to do it, is good at it. But I get a sense of something.
She says she's trying to generate power as well, so it might be the way she's moving it, because she's trying to generate that power. You could assume that she's really putting more effort in than you would normally, rather than using technique.
And then you get exactly the your scenario, just the bit you've been reading out there. Absolutely. Yeah, I think we tick that. I quite like that. So that's very much overuse, overdoing it too quickly, maybe the whole warming up, warm down thing. Our work, of course, is she getting any treatment? Is she looking after herself in terms of soft tissue work? We don't know. Structures that we, using our palpation skills, what specific structures should be palpated on the patient with this complaint? Well, things like the ribs would be quite good, wouldn't it? We could. But I think your clue, Anne, around posture is a good one. I'd like to check her pelvis and that whole anterior tilt of the pelvis stuff, which is our bread and butter of all our back complaints, our chest complaints. What's happening in that core stability? I was talking about this in the classroom recently, and I don't know, Gabby, if you were. It could have been when you were there one Saturday. The relationship. I'll try and get my hands on in the camera. So the relationship between the diaphragm and the pelvic floor is really crucial. And I'm trying to get my hands in the right place. So if that's your diaphragm and here's your pelvic floor, the two have got to be over the top of each other, and the pelvis must be kind of level. So the ASIS is slightly low at the front, front of the body. Absolutely normal, 5 degrees, whatever, 10 degrees, something like that. But the diaphragm has got to sit over the top. And if you're kind of tilted at the front, the chances are the diaphragm comes out the back. So you haven't got this lovely core basket of bowl between our pelvic floor, our abdominals, our back muscles, and our diaphragm that causes that whole kind of capsule of our pelvis. And it's such an important sort of fascial kind of a model that we've got to get right. And if we're anteriorly tilted and we start shifting our, so when you look at somebody's sideline, imagine their diaphragm and imagine their pelvic floor. Are they over each other? Are they sitting on top of each other? Or is there a kind of, and I think that gives us a really good picture of that word core stability. And we get a bit obsessed with it being a pelvic floor thing, or you've got to strengthen your pelvic floor and hold your wee and all those things that we do to try and, yes, which is important. but the abdominal stuff and our lower back and QL and rectus spinae, our abdominis muscles, and of course, hip flexors, all sit in that kind of model of getting that pelvis right. So that would be one of the structures that I would pick up on and just seeing what's straight. Oh, did we talk about that, Gabby, on Saturday? I think I did. I can't remember.
Yeah, we did.
Yeah, it's come
we
up before.
Started to talk about pelvic muscles.
Yeah, it's very important, but particularly for, just to throw this in, I was thinking about your lady and, mums who have had, 2 or 3 children, and that whole kind of potential bladder weakness, and, that whole kind of journey of getting that kind of restoring that kind of capsule, if let's call it a capsule, of that whole core. It's so important, and we get to thinking about Pilates, and we get thinking about other things, but core stability stuff and all that. But actually, from our point of view, let's look at where the diaphragm is in relation to the pelvic floor, because we get a bit obsessed with the pelvic floor stuff and not the kind of upper pelvic kind of stability in relation to our diaphragm. Just so add that to your thinking about your lady. When you see a sideline, does it all line up? Food for thought. So we check out our pelvis. We check out obviously the ribs and intercostals. Other things that you might want to structures that you think you should palpate for this person. What would you want to get your hands on to just see what's going on?
Shoulder.
This is where you say things, Gabby. This is where you say, are the inferior angles of the scapula in line? That's what you do. That's what you say at this point. That whole shoulder girdle is a key part of this rower, isn't it? What's happening with the shoulder girdle? Is she protracted? Is she elevated? When she pulls forward, when she sits back, are the inferior angles of the scapula, are they in line? Are they in the right height? Is she over dominant? Does she rotate? Is she nice and square? All that would be a really important, getting a feel of the, why has this happened? Is this just because she's done the things that we've already said? Or is there some other kind of imbalance in the front and back and the posture and how her shoulders sit on her rib cage? Remember that the scapula, the shoulder blade, is completely held in place by the, 17 muscles, 18 muscles that attach the scapula to the body. It's held in place purely by muscle and fascia. The only kind of joint, I guess, is the, where the clavicle comes through and joins onto our sternum. That's the only kind of bone-to-bone bit. The rest of it just sits there. Sorry, Gavin, I put you on the spot there, didn't I? I'm really sorry. Any other bits you might like to palpate and have a look at?
From your diagram that you put up when you looked at the muscles, you saw where the 6th rib was, and I was interested in the relationship to that with the subscapularis. Yeah.
So bring it back up again.
Yeah.
Let me bring it back up and just talk me through it, and then you can. Okay, so do you want me to turn it round the back?
Yeah, please.
So 6th rib. Go through, and what you think? Do you want me to take stuff off?
Yeah. So if you take the spinae rectus off, rectus spinae off. And if you can take the infra and supraspinatus off, please. It's like a game show, this, isn't it?
Yeah. There's the only snag is that there's no treasure. Well, this is it. This is as good as it gets. Is that happy?
Yes, yeah. So just looking to where that rib is, obviously the movement, if you rotate round a bit, I think, is against the subscapularis at that point. So when she's rowing, there might be an adhesion or a friction potentially between. So I'd like to have a look under there if I could, just to see if there's anything else going on.
Let me get, so here's the ribby, 6th rib. This is it coming round the front.
Yeah.
And then we've got serratus there.
Yeah.
If I take serratus out of the picture.
Yeah.
And get hold of the 6th rib again. And here's subscapularis, which you were thinking of, weren't you?
Yeah.
Yeah. So 6th rib.
But it depends where she's feeling.
In this kind of area.
Yeah.
Interesting, isn't it?
I don't know. Would that be right to have a prod around there?
Well, yeah, I think that those whole kind of that strong medial rotator or subscapularis is going to be a very well used muscle for her.
Mm.
As she brings back the oar and then medially rotates.
Yeah.
It's going to be an important. I don't know. I don't feel proficient enough with really examining her moves. Do you know what I mean? I don't know rowing enough to the detail. Interesting, then. No, I get your thinking. I get your thinking, and I think I tick along that same. Serratus anterior. And serratus anterior, subscapularis in that area here, I think is a good one. And coming up through the rhomboid area and through here too is going to be, the rhomboids are going to be a key player in all that kind of. We don't know where the actual palpation swelling is, do we?
Mm.
I don't know why. I'm guessing that it's somewhere around the front here, but I don't know why. It doesn't actually say, does it? Exactly where it is. Yeah, good one. Food for thought. And that's pretty well it, really. The next part of that, identify the landmarks that could be used to easily locate the 6th rib. I think we're kind of by far the easiest one I know is coming under the inferior angle here of the scapula, and if you come across, then you're pretty well on. 6th or 7th rib here sits sort of in line-ish, and then you're coming up one at the front. I think this is it's kind of sternum, isn't it? Your you're dropping in here. Don't know. I'm just playing around here, really. I think to come through here and come out in line 5th and 6th rib. Would you? I'm just having a little poke at my sternum and just coming out and feeling that arch through here, 6th, 7th rib. That's quite a nice way of looking for it as well. I think you've got a little bit of an issue here if you're working with a lady, because you're pretty well on sort of breast tissue, so you've got to be kind of a little bit careful there, haven't you, in terms of palpation. And although 6th rib I think is a little low, isn't it, for breast tissue, and you could ask the client to hold breast tissue out the way while you do your palpation there, sideline or seated would work pretty well, I think. I don't.
I was massaging somebody earlier, and on the sideline, and I must admit their ribs were quite tight, and I was working in it quite well from the side, with their arm down by, about that sort of area.
Sideline work on the intercostals work incredibly simply and well, and you know, it's a sort of a bit of a no-brainer really, you know, working on the whole intercostal, because gravity takes the breast tissue down towards the couch. It allows you, by definition, the client can hold breast tissue out of the way if need be, and you've got good access there all the way round to the ribs, to the spine, and you know, you can do some really nice work. Nice work there. Well, I think our row is sorted, really. I think we've done a reasonable job of understanding what the poor girl is going through, poor lady. Slippy rib, I think, Anne, are happy with that? Should we name this something? Should we call it this?
The squidgy slipping rib.
The squidgy. I think you're right. I think okay. Anything else that anybody wants to sort of bring into that or observe, or?
Would you look at pec minor as well?
Only in terms of, you know, the stability of the shoulder girdle is all going to be based on its assessment of if she's protracted, isn't it? So if we kind of go back to our little model and pull out, pull out a little bit and come through, then if I pop on just a muscle or two, then pec minor, you know, just remind ourselves its job is you know, that pulling forward. So if we have this rower, and I think they do become, I remember, it's a shame that Carl's not with us tonight, because he's a rower and he was on one of our groups, and I remember seeing him, and I think it's a positioning of what your job is in the boat depends on how protracted you are, and I think this is a pretty key theme for rowers, that one side will be quite more protracted than the other if you're with one oar, yeah, I think it would all be part of our assessment, I guess, Anne, wouldn't it? You know, if there's a rib issue, then what's happening here in terms of stability, positioning of the scapula, and all the things we know about in terms of you know, protraction, and pec minor, serratus anterior being the muscles that hold us in that rounded shouldered position, you know, that whole thing that we deal with every time we see anybody. You know, I don't know about you, but you know, 9 times out of 10, this is what I, you know, what I work with. Is that fair, Anne? Was that your thinking? Or just thinking of attitude?
Yeah.
So we would need to have a good look at her posture and see, you know, I have a sense of a person who's pretty driving herself pretty hard, wants to be good at what she does, gets a buzz out of being kind of, you know, these sports are, you know, rightly quite addictive, and people love getting really into them and being an expert at them, but just forget about the kind of aftercare and the preparation and the kind of work of how you kind of keep, you know, we keep well and fit by keeping our bodies sort of strong and long, and you know, trying to get that model right for people who want to strive is hard to do. Okay, I think that's a reasonable kind of reflection of Sophie. I think we put up with her for a bit longer. She's done well. I'm gonna stop the recording, and then we can talk about other things or whatever you want to do. But thank you for your inputs on this. And it's always useful just to share, isn't it? And get a, you know, and as long as we've got Anne Googling, we'll be fine. And you know, it's important, isn't it, to just pull information together. It isn't about knowing the answers. It's about the joint effort of pulling things together and discussing it that really
Is Chris frozen for everyone else?
Yeah. Yeah. Thought it was me.
Chris, can you hear us?
Thought it might be because he stopped the recording, but it looks like it's still recording, doesn't it?
Mm.
Yeah.